Elias. Hey, Chelsea.
Chelsea.
David, Eric? Yes.
Or let you get settled.
We do anticipate some of the folks for the hearing today to be online, particularly one of them from California. So
He emailed me some photographs. She wanted me to be able to share, but I don't know exactly how.
well,
to
she
share.
can if she joins us, and I don't, she's not listed as a participant. There's nobody else on but us.
It says there's 7 people out there though.
There's
There she is. I'm sorry.
Closer.
Yes, so joining us also,
Chelsea.
sorry, that's Chelsea, that's right. But joining us also is, let me just stop my video for a minute. So, is, Ronnie Solomon online? Ronnie, can you hear us okay?
You might have to let him pin. Oh, her.
She got a participant link, but maybe she's logging in
Vanessa.
some other way. Vanessa is also, I think, a participant.
I'm
Maybe.
sorry, I can't hear you.
Vanessa Shipalo,
Uh-huh,
she's also one of the panelists.
okay.
They-
Have
some
they
of
been
them
admitted to the meeting?
may be,
They're just joined as attendees.
yeah,
So they're hearing, we'd have to promote them as panelists.
Yeah.
So I'm gonna promote them as panelists now, or should I wait until
we
we?
can wait till we get to the hearing.
Okay.
Just a little bit of business.
Okay, great.
All right, let me call this Gloucester Board of Health meeting to order. It is Thursday, May 2nd, 2024. It's roughly 5:30. We are in the Harbor Masters Conference Room, and this is a hybrid meeting. The public is welcome to attend this meeting in person. However, you can also join remotely. But please note that the in-person meeting will not be suspended or terminated if technical problems interrupt the remote connection. So first of all, what we usually do is go around the table and introduce everybody. That makes it easier for individuals to hear the speaker. Starting with Thor.
Thor Akerley, Board of Health member.
Dominique Curley, Director of Public Health.
Eric Kaplan, board member.
Marco Pelzolo, board member.
Erin George, board member.
Joe Rosa, board member.
Rocco DeFilippis, Assistant General Counsel.
Catherine Aparo, health inspector assistant.
Leslie Whalen, Title V Unitarian.
Dan Labor, prevention coordinator, health department.
Cindy Junker, public health nurse.
Danielle Larrabee, administrative assistant.
Great. Next item on the agenda is public oral communication. That's an opportunity for anyone in the public to speak for up to 3 minutes on an item not on the agenda.
I don't see any hands raised.
Okay. So the next item on the agenda is the approval of the April 11, 2024 meeting minutes.
I move that we approve the April 11, 2024 minutes.
Second,
Second.
any discussion, amendments, changes? No? All in favor? Or go around and you have to do it in live, as it were.
Yep. Thor, yes.
Eric Kaplan, yes.
Marco, yes.
Erin George, yes.
Joe Rosa, yes, even though I may not have been at that meeting, but it's okay to approve it. The minutes are approved unanimously. The next item on the agenda is really three items that are being dealt with separately, even though they're more or less similar, but there's no individual responsible for all three, so they're being dealt with individually. First item is the public hearing regarding 16 Beechcroft Road to define the enforcement actions for failure to connect to sanitary sewer within the 2-year deadline stemming from a notice of failure in 2021. And I'd like to ask Leslie Whalen, our sanitarian, to present the findings.
Sure, thank you. 16 Beechcroft Road, the cesspool is failing to protect public health in accordance with Title V regulations, 310 CMR 15.303 1A1, due to a clogged cesspool and or due to the cesspool location below the high groundwater elevation, which would be 15.303 1A7. Notice was provided to the owners regarding this determination on 9/21/2021, with a deadline to connect to sewer 2 years hence, 9/21/2023. A second order was issued in July, on July 10th, 2023, reminding the owner of the deadline that was soon to be coming about.
Right. So
Ronnie Solomon and Vanessa Stefalo are both now panelists and can speak.
so I'm not quite sure who the owner of 16 is, but
Yes.
if that person wishes to speak.
Joseph Messina.
Ronnie, I can see your hand raised, but I think you have full audio, so feel free to speak, unless your computer is muted.
I wanted to address that question. The owner of 16 is Joe Messina, as you pointed out. He's unable, he doesn't quite have the technology to get on Zoom. So he knows that I'm representing him as well. I live next door to him. I live in 20. He covers the two lots 16 to 18. I'm in 20 and Steve and Vanessa Cefalo are in 22.
Do you have any comments to make at this point?
Well, Miss Whalen could share, or I can share screen. Actually, the work has begun. The work has started today. A neighbor just said, hey, they're doing it. And Steve Cefalo sent me pictures. And I sent them to Ms. Whalen.
Yeah.
So if Leslie wants to share them, she can. The work is being done on all three properties by one drain layer who's been approved by the city, Paul Wright. And all the plans and permits have been approved and the work is proceeding. That's what I wanted to let you know. Sorry it's taken so long.
It is correct, the work has begun. And unfortunately, the work needs to be completed in order for us to
Right.
be satisfied.
And so it's terrific that the work is being done apparently for all three properties. So I applaud that. But in order for the board to have some ability to enforce the actual completion of the work, I would propose that we exercise an enforcement order that would have two stipulations. One is that all persons not occupy the house and use the septic system. And well, I guess those should be separately stated. All persons shall immediately cease and desist from using the septic system, and no persons shall occupy the residence. And given that order, the orders would remain in effect until the owner has completed a final inspection, closing of all the permits related to connecting to property to the municipal sewer, and a final inspection regarding the abandonment of the cesspool in accordance with Title V. So I would move to the board that we impose such an order with those stipulations. Is there a second? Do we need a vote? Is there a
I will
second?
second that.
Any discussion, any further discussion?
I would just say, for conservation purposes, you know, I don't know. They probably had to file a notice of intent for this. Do you know if that's correct, Leslie?
I would think they would, but I don't know honestly. It hasn't been discussed. We haven't.
I believe they're getting all the appropriate permits, but we can, well, please,
Hi, yeah, just wanted to let you know, on the enforcement order, that's completely fine, because the house 22 is turned off every winter, because of the septic system, so no one is living in there at this moment or plans to be until the work is done.
That's great.
My only point was that to go through conservation, you have to do an as-built and then file, and it could be June if the work's completed in the next week before they get a certificate of compliance from conservation. That was my only comment about that. I don't know if pulling them up until then is necessarily appropriate if it's a conservation issue, but you know,
Leslie, do you,
I think that they could occupy once they're connected to the sewer and go through the process with conservation and get their certificate of completion for that work, right?
right, we said all permits, closed up permits from the city as part of the
I get it.
enforcement order. That was and maybe it doesn't matter to the homeowners, but just a thought, not that, you know.
would not having that permit or whatever it's called, license, prevent them from occupying the property?
Well, from what you had said as part of the enforcement order, my interpretation was that it would, because that was a permit that wouldn't be closed out. Associated with the installation of the sewer.
So we also didn't set in my motion, which was probably inappropriate, not setting a deadline for this. Given that it's all happening, Leslie, do you have a sense for when it's a reasonable time to expect completion of connection to the sewer?
Well, I would say it won't matter to us when they connect, because if they aren't connected, they aren't polluting. And our concern would be the pollution, so they can take as long as they want.
Because they're not occupying or running water, they're, you know.
Right, that's
Something
certainly
like that.
true. Rocco, would you agree with that?
Yeah, the order not to occupy would flow from the standards for human habitation. You can, and our ordinance says you can't occupy or have an occupancy permit for a building that doesn't have a septic disposal system. So if they are tied in to the system, that essentially alleviates the concerns about the occupancy. And then they would just need to go through the steps to close out those permits so that we know that so the city knows that the process has been complete through final inspection.
So are you addressing Thor's concern? Is that-
I don't think that it essentially, like we said, if they tie into the sewer, that alleviates the occupancy part of the order. But the system still needs to be abandoned in accordance with Title V, so I think it's appropriate to keep that as a condition in the order.
Okay,
But the comment that all city permits be closed out
That's what we
is
have to-
probably too broad.
Yeah.
Because obviously the wetlands
Right,
permit
right.
needs to be closed out, but it doesn't have to happen until that process unfolds, which could take an extra month beyond when the work is done.
right. So so should we amend the motion to read that connection to the municipal sanitary sewer be completed and that the appropriate inspection regarding the abandonment of the cesspool be done with the appropriate oversight by the department?
I think that's a good correction, yes.
Okay, so with that amendment, if that's clear,
I'll second that.
second that, okay. Any further
Chairman, if I may, one of the items that I also wanted to see is if you would approve the rights for me to sign the order to allow us to act promptly. You know, if you all vote to execute this, it would
Yes,
be
right,
helpful to not have to have everybody's signature on it.
right. I was gonna make a separate
Oh,
motion in that
okay,
regard, but we can tie it into this one in the interest of speed. So for the board's edification to move things along, we would all have to sign these orders. But if we can get we can give Dominique the ability to sign for us, and that will facilitate things rather than her chasing you down to,
We can give her our
To get
proxy
your
vote,
signature.
our proxy vote.
sorry?
We can give her our proxy. vote.
Yes, right, exactly. So with all that said, any further comments from the board? No? So Thor,
Thor, yes.
Eric, yes.
Marco, yes.
Aaron, yes.
Joe Rosa, yes. So, thank you, all. Let's move on to the,
She had a question, she wants to say something.
Bonnie,
yes,
Right, so I just want to clarify to make sure that I've got it right. So we can't reside in the residences until it's tied up and all the permits related to the tie-up are approved and finalized. But the Conservation Commission, making sure that everything is closed off properly and stuff in the cesspool, if that's delayed, we can still now come to our properties as long as it's hooked up to the sewer. Is that correct, according to this motion?
the abandonment of the cesspool is also part of, is the other half of tying up to the sanitary sewer. So tie up to the sanitary sewer, once that's done, you also need to abandon the cesspool so that nothing more is going into the cesspool. Those
Right.
two things will allow you to move into the property and use water.
Right, I
The
believe that Paul
issue-
Wright, the drain layer, has that as part of his work.
Correct.
In other words, he's not just doing the one, he's doing the both. So,
Right, okay, good.
okay, so you don't need me anymore, is that correct?
The same is gonna go on for your property if yours.
Oh, I
is-
see, you've just decided for Messina's property, now you
Yes,
need to go
yes.
through each one, I got it.
We're doing it one at a time because each homeowner is responsible for their own property.
Right.
There is no one individual responsible.
Got it.
You,
Okay.
you can certainly help us and stay on, stay on if
Right.
that's.
No
convenient for
problem.
you. Let's move on to the public hearing regarding 20 Beecroft Road. The same enforcement action for failure to connect the sanitary sewer within the 2-year deadline stemming from an August 27, 2021 notice. Leslie, I don't know if you have anything further to add, anything different?
It's a little bit different.
Okay,
The cesspool serving 20 Beechcroft Road is in violation of Title V, 310 CMR 15.303, 1A4, in that the liquid depth in the cesspool is less than 6 inches from the invert pipe, or the remaining volume within the cesspool is above the liquid level. Let me rephrase that. The remaining volume within the cesspool above the liquid level is less than half of 1 day's flow. And or the cesspool is clogged, which would be 15.303 1A1. The determination was made on 8/27/2021, and an order was written on that same day with the deadline to connect to sewer 2 years hence. 8/27/2023. A second order was issued on July 10th, 2023, reminding the owner of the deadline.
good, thank you. So, for the purposes of the board, it's the same issues that at 20 Beechcroft Road. Their cesspool system is in failure and has been for 2 years, beyond the prescribed 2-year time frame to get it repaired or connected to sewer. And therefore, I would move, if someone has written down what motion I made for the previous piece of property. It is that all persons shall immediately cease and desist from using the septic system, and that no person shall occupy the residence, and that shall remain in effect until the owner has completed final inspection and closing of the permits related to connecting the property to the sewer. And a final inspection has been done by the department regarding the abandonment of the cesspool in accordance with Title V. Is that adequate? Yeah, good. Thor,
Second,
any discussion? It's the same issue,
It's the first one.
the neighboring property. Thor, how do you vote?
Thor, yes.
Eric, yes.
Marco, yes.
Aaron, yes.
Joe Rosa, yes. Any,
Chairman, do we need to again say that I am able to sign?
I'm sorry,
forward
yes.
and-
So I would also ask that the board authorize the director of the Department of Public Health to sign the enforcement order on behalf of the board. Thor,
Thor, yes.
Eric, yes.
Marco, yes.
Aaron, yes.
Joe Rosa, yes. Thank you. Sorry, I didn't ask for any public comment. I presume that there was none to be had. It's the same issue. Regarding, let's begin the public hearing for 22 Beechcroft Road. The same enforcement actions for failure to connect a sanitary sewer within the 2-year deadline stemming from 10/27/2021.
So 22 Beechcroft Road is failing to protect public health in accordance with Title V, 310 CMR 15303 1B 2B. The cesspool is within 50 feet of a bordering vegetated wetland. Notice was provided of this determination on 10/27/2021, and a deadline 2 years hence was given of 10/27/2023. A second order was issued July 10, 2023, as a reminder to the owner of the impending deadline to connect to sewer.
So as before, the septic system at 22 Beechcroft Road is in failure to protect public health and the environment. The owner has failed to connect a public sanitary sewer within the prescribed 2-year timeframe. And therefore, I would move that the Board of Health order all persons shall immediately cease and desist from using the septic system, and that no person occupy the residence. The orders shall remain in effect until the owner has completed the final inspection and closing of all permits related to the connecting of the property to the municipal sewer system, and the final inspection regarding abandonment of the cesspool has been observed and approved by the department in accordance with Title V. I'll
Second,
also add, Les, Dominique, remind me once again that I asked that the board authorize the director to sign the enforcement order on behalf of the board. Any comments regarding any of that?
Mr. Chair, just a little bit out of order, but for the purpose of the record, these are the letters that sanitarian has provided in support of the history of notification at the property for
Very good.
each one.
Good.
I second the motion.
Any discussion? Thor,
Thor, yes.
Eric, yes.
Marco, yes.
Aaron, yes.
Joe Rosa, yes. So, thank you.
Thank you.
And we look forward to a completion pretty soon. It sounds like work is happening at a good pace, and hopefully you'll pay attention to the contractor and make sure that it continues.
Oh, yes. Take a look off of Thatcher. You'll see it tomorrow.
Great. Thank
Thank you
you.
very much for staying in touch with us and
Thank you.
for understanding, you
Sure.
know, dealing with it. Thank you.
Thank you.
Thank you.
Bye.
Bye.
We all set?
I believe so,
Regarding that
yeah,
issue?
and then I'll get the orders printed out and over for your signature and we'll get them served.
Okay, thank you.
Great.
Thanks, Marco. Thank you, Marco.
Yes, you can, you're.
Been such a day.
Dominique, you're next on the agenda, I believe.
Yes, to give you an update, and then also I wanted to just provide a briefing on Good Harbor Beach, the bathing beach testing protocols that we're going to follow this year. So from an update standpoint, we're hopeful that we'll be able to start interviewing for the replacement of our food services inspector or our food inspector. I think beginning next week, we'll see the list of candidates.
It closes today at 6 o'clock.
Today at 6 o'clock, we were waiting with bated breath to see who's applied. Because it's a very important role.
4 minutes.
Um,
4 minutes.
Also, we've been working very hard on, trying to determine how best to operate and to steadfastly improve operations. And as we were saying in another meeting, Catherine Apros, who's joined us as a health inspector assistant, has been doing a terrific job of documenting and bringing business process to light. And some of this you may see in Gabby's briefing as well. What I'd like to do now, if I may, is turn to a presentation I have on bathing beach testing and, update you all on our progress against the same. Can you all see my screen? Yes, you can. That's great. Okay, so I'd like to brief the board and our city residents on the protocol we follow for bathing beach testing. I know there's high interest in the results, and in this educational briefing, we're trying to answer some of the frequently asked questions from city residents. The health department's testing is guided by 105 CMR 445, which is the state sanitary code, chapter 7, minimum standards for bathing beaches, which regulates public and semi-public beaches to protect the health and safety and well-being of the users who are using those bathing beaches. These regulations don't apply to private beaches. So let's look at where we test. Here's a map of the city. And we're looking at the beaches that we're testing. Each location has one test location with every testing moment, with the exception of Good Harbor, where we split the creek from the beach. Here's a look at how we test. The Gloucester Health Department, or GHD, collects the water samples, and it does not physically test the results, which I think is not known by all the residents. I want to just reiterate that. While we do the testing, we do not conduct the analysis. The analysis are sent the test is sent to Massachusetts Department of Public Health certified lab, who conducts the analysis and reports the results, both to the Mass Department of Public Health as well as to us. So we are responsible for collecting the sample, posting the results of that sample, and acting on the results, such as if an exceedance happens, closing the beach. The lab is responsible for receiving the analysis or producing the analysis and then reporting on the results to both parties. And the Mass DPH certifies that the lab is appropriate to be used, pays for the tests, with the exception of the second test. If we have to do more than one test, then we are covering that ourselves. And then finally is also posting the results. We are following something called chain of custody, which I'll talk more about in a minute. And we go, from there into following the law that they've set forth, as I described earlier. Sorry, I have a few extra papers here. So we follow the chain of custody. And what is the chain of custody? A chain of custody is a protocol that's followed so that we are able to be sure that we're, following procedure appropriately every single time. It's defined by the Department of Public Health lab that's been certified to be sure that we produce the most accurate results. This process we follow with every test for every beach all season long. And what is not stated here is that we test in pairs to be sure that we have two folks at all times where possible testing for safety reasons. So we start by writing the date, the time, and the location on the bottle. We then wade to a depth of 3 feet and wait for the debris to settle. We remove the cap from that sterile bottle, from the sterile sample bottle and take, seal the bottle, discard a few millimeters, I'm sorry, I have a little out of order here, forgive me. Go to 6 before 4, I apologize for that. We remove the cap from the sterile sample bottle, we plunge that bottle 12 inches under the surface, filling it with one downward sweeping motion, moving it away from the tester's body. We then discard a few millimeters of that water to allow for airspace. We seal the bottle, we place that sample bottle in a cooler with ice packs, and then we deliver that sample to that certified laboratory for testing. And we typically receive testing results the next day. So what are we testing for? When the state certified lab tests the beach water, they're looking for enterococci, I always say that. Enterococci, thank you. And these pathogens, of course, can sicken swimmers with urinary tract infections, meningitis, abdominal infections, and other health effects such as diseases of the eyes, skins, ears, and respiratory tract. So it can be pretty bad if it gets into your body. And now I'd like to move on to understanding the results. So how are our results interpreted? This is a fairly complex slide, so I'm going to spend a little time on it. Under Massachusetts regulation, beach water quality must meet both the single sample and the geometric mean, or what we call a geomean standard. According to 105 CMR 445.030 Section B, bacteriological quality of the bathing water is unacceptable based mainly on the following criteria. Either 2 single samples of bathing water collected on 2 consecutive days exceed the single sample water quality standard, as you're seeing on the left-hand side. In this graph, you're looking at points at the red dotted line is when tests are happening that are below, and then you can see points when we have exceeded. And in this one day, which I'll get to in a later example, that was a particular large exceedance after a heavy rain. And I'll tell you a little bit about why that's affecting the clothing of bathing beaches beyond that one particular day in a moment. So the other graph you're looking at is a geometric mean, where you're looking at 5 days that reflect the typical water quality conditions over, say, a month. And in this case, you're looking at how this one day and these test days where they also exceeded actually drive up the mean, which allows us to, forces us to actually keep the beach closed for a longer time than the actual testing results might warrant. Tell you more about that in 1 minute. In this case, the mean cannot exceed 35 colonies per 100 milliliters. So a geomean is calculated, based on, as I said, those roving 5 days. So let's look closer at the geomean and its impacts. So in this example, we have, as I said earlier, a few days of rain, the 7th and the 8th. We might have tested day 1, day 2. We test on day 1, we get the result back day 2. Day 2 also is exceeding, but we don't know that yet. We're closing on day 3. And now, right now, because of these 2 testing days, we're driving up the roving 5 days to above the exceedance level of the 35 colonies per 1,000 milligrams. So these blue lines here are demonstrating a 5-day rove. That helps you understand how once we have a big number, like this day of heavy rains, the geomean is going to be, high for quite a while after that point. In this case, I think until August 23rd, because of that 1 day of high exceedance. Now, the reason I'm showing you this and why it's important to understand is that because in this case, Good Harbor Creek or Cressy Beach are heavily tidal, as soon as the tide comes in and out for a few cycles, oftentimes the next day the water is fine. However, because of the geomean requirements, we are having to keep the beach closed for much longer than it takes for the water quality to improve. And so what that means is that if we test on a day of heavy rains, that geomean is going to be highly impacted, as we've seen in the past. So where we're testing right now is, we're testing at the following frequency, at least 5 days before the bathing season. We're going to start, in fact, we've already started to test and have a baseline measure. We're gonna be testing them weekly at Wingershik, Pavilion, Cressy's, Niles, Plum Cove, as I said earlier. And then in the case of Good Harbor, in particular, we're going to be testing as close as possible to mid-tide, regardless of ebb or flow, so that we can have the most accurate and consistent results in all of our test reporting. Another thing to understand about testing is that we're going to be testing consistently on Monday so that we are able to work through the dynamics of the tidal idiosyncrasies so that hopefully by the weekend, any of our testing will have resolved and not interrupt us for the weekend season and tourism for the same. On days, sorry, Eric, on days of heavy rain and tide events for beaches where our data has shown consistent exceedance, as an example, Good Harbor Creek, we're going to change things a little bit this year. So we're not going to test on the day of the big rain or the day after the big rain, because we know that from all of the water running off of the streets and down into the creek, we will almost 100% of the time have a large exceedance. Instead, what we're going to do is preemptively close the beach on those days for the creek. So the day of the heavy rains, the day after the heavy rains, we're going to preemptively close the beach. And then we're going to resume testing on day 3 or after enough tide cycles have run, depending upon how and when the rain is stopped. And hopefully we're going to see, as we typically have for the last number of years, the rates come back down to normal. So that's going to allow us to not have that mean expand longer than it needs to. And this approach has been cleared with the Mass DPH as an acceptable protocol, and many other beach communities follow this protocol.
Dominique, if I can just interrupt you at this point. That protocol would probably, correct me if I'm wrong, probably be only applied to Good Harbor Creek because that is the one that has shown exceedances after a heavy rain, not Good Harbor Beach.
Not Good Harbor Beach, but Good Harbor Creek, that's correct. So the beach would be open. Yeah, unless of course we had a test, but then that had already had it closed, but it would be open. It's really just the creek that we would be doing this for. In fact, I actually can turn to Bree and Gabby here. Are we planning on testing on a heavy rain day in Good Harbor Beach, or would we also just wait in that moment and not test on the beach?
I think we would continue to test on the beach.
Yeah.
To allow it to be open as much as possible.
Yeah.
Yeah.
Right, so this would only apply to the creek, which is the place where we have the most exceedance, and it's really designed to just allow us to have accurate data, basically.
Yeah.
So when we have an exceedance, we will be closing the beach, and there's requirements for how these signs have to be posted, and we're working with the Department of Public Works right now to determine how we can, as quickly as possible, get the appropriate signage up. You know that, if the beach has been closed in the past, we'll see these signs that say beach closed. And you might see a smaller sign that the Department of Public Health has to post, which has all of these reasons, the date, the reason, et cetera. And so what we're hoping to do this year is work with the Department of Public Works to be able to get these signs up more quickly and have the reasons front and center and large on the sign itself. So more detail on that to come as we're working through the logistics of that. Important to know that when we exceed acceptable limits, we have to close the beaches. And the Department of Health can also close the beach, as I said earlier, for this precautionary reason. And we cannot reopen the beach until the water test has been conducted and the results are within acceptable limits. Important also to understand is that we are not policing the bathing population, nor does the DPW, the lifeguards that are on the beach. We're merely posting the signage to make the bathers aware of it. The City of Gloucester posts results on our website, and we have, if you are interested in understanding whether a beach is open or closed, you can go to the city site and see quite easily the results. Also important to understand, the Massachusetts Bureau of Environmental Health posts the same test results. They lag ours because ours are coming as soon as they're received. We post them and we act on the beach closures, and the Bureau of Environmental Health and Environmental Toxicology might take a little bit longer. And also the Mass Department of Public Health has a new interactive beach water quality dashboard that lets you look not only at our beaches, but also beaches up and down the coast of Massachusetts. And it's kind of interesting to look at and understanding how we're testing versus other beaches in the area. And so that is all I wanted to show you. I just wanted to be sure that you understand what we're doing on the mean side, where this large day where there was a lot of rain, this is the day when we wouldn't test, right, at the creek. We would instead test as we would every Monday or every day afterwards. But on a large day, we would instead preemptively close the beach, close that beach the next day, and then resume testing on the third day, because we'd have to test and have a result before we could reopen. But I really believe that this is going to save a lot of time. In this example, we had almost 10 days of closure. We hope to reduce that down to a more normal, number of days, say 2, based on, what's actually happening in the creek.
It's actually a 2-week closure.
Sorry, thank you, 2-week closure, thank you, Eric.
I have a question. Remember correctly, there was a lot of work done there?
Sorry?
There was a lot of work done in that area as far as septic and sewer. How do we know that it's just the rain and it wasn't that?
That's a really great question, Marco. So the city has, gone through a lot of exercises to look at the cause of what's driving the numbers going up or down. And I think there's been last summer, before I joined this department, there were several presentations made that explained to the community the path that was taken. One of the important findings that I don't know if it made it to the, to the meeting as loudly or as, sort of front and center as it could have, is that the DNA tests that were performed on the, up and down the creek showed that it was, avian DNA, not necessarily human DNA. And so what we're doing this year also, which I don't have in this deck because it is very new, but we are, contracted for it. We have a lab facility that we're working with right now on their chain of custody protocols to be able to every month run a DNA test to witness what's happening. We suspect those results. We're looking for human, avian, and canine DNA in the enterococci. And so we're hoping to be able to share those results as well. And with regards to what the DPW is doing, they continue to make progress on anything they find that might be causing, infiltration into the pipes that might be dumping into our harbors. And, to the best of their understanding, there's really nothing right now that would, and they said the same last year. But, as I said in my presentation, earlier in the year surrounding stormwaters, if you as a citizen see water running in an inappropriate way, it's a really good idea to let us know so that we can be sure to let the DPW know, and also if it's in the case of septic, act on it right away.
Yeah, many of the exceedances correlated directly with heavy rainfall before the DPW started doing extensive work. So, and it's also correlates with other communities. Other communities are finding exactly the same thing. Probably correlated mostly with the development that's happening in marshy areas, getting smaller and smaller, birds are being more and more concentrated. Who knows? We'll hopefully get some more data by doing this DNA analysis that Dominique alluded to, and maybe we'll learn more about what's actually causing these effects.
Yeah, and the chain of custody in that instance is quite robust. Keeping them cool, getting them next day. There's a lot of shipping requirements that we're following. So, our testing of the local waters following the protocol that I described earlier is, it's important that we follow that consistently. In this case, there's even more protocol that has to be followed to be sure that we have an accurate sample and that we're testing it. Do you guys want to add anything?
Yeah, I was gonna add, the lab is in New Jersey, the only lab that can do this type of DNA testing. So the protocol around that we'll have to factor in the time frame to ship overnight, and then I think it's a 3 or 4 day turnaround. We could have chosen 24-hour turnaround, but the cost associated with that is astronomical.
Yeah,
So
we're not using.
we don't need it
To close beaches.
correct. It's just to inform us. So we're going to start that hopefully by the end of this month. We're waiting for the supplies needed to do it. Are you done? So you want me to?
I was just gonna ask, is that just for the creek or is that gonna be at all?
Just for the
Okay.
creek, yeah.
I mean, if we see high exceedance, there's no reason why we couldn't expand it to another beach.
No, I
There's-
was
yeah.
just curious, cause it seems like a lot of the issues have been related to the creek, so.
Yeah. Yeah, and those, you know, the 3 properties that we were just working on are, you know, right there as well. So we're, you know, there's steadfast progress that, you know, Leslie's working on consistently on any septic system that could drain anywhere near the waters that could drain into that. The DPW's vigilant about any sources of diffusion or infiltration that could be happening. And this work, we're hoping to just have more and more information, so. Anything else that we'd add there?
So I'm gonna speak a little bit in my presentation as
Okay,
well.
wonderful. I'm going to stop sharing. I'll have Sheldon stop sharing. Next item.
Good segue. On page 8 and 9, I'm gonna actually jump to the end since we're talking about the creek. I've been in the creek 3 times since February. And the first water sample was below 10 milliliters of 100 mil. On March 26, we sampled again, it was 20, so well below. Dominique had noticed discharge from a storm drain adjacent to the bridge, which we sampled, and it was less than 10. It was actually lower than the actual. So that was not a red flag there. And I just got the data from the sample on the 29th, which was 52, which was strange that sort of jumped up. Then we had light rain the day before and the day of.
Still beneath the
still-
state
still
levels of
beneath.
exceedance, yeah.
Yeah, well below. And then, as we mentioned, we've contracted with the EMSL laboratory out of New Jersey for the DNA sampling. We were going to start in June, but I think we'll maybe be able to start in May. Well, we just need the supplies from them. So that's it on that. As Dominique mentioned, we have an open health inspector position. We rewrote the description to be broader so that we could have more cross-training. It's been posted now for 2 weeks, closing today at 6 p.m. It's closed. And we're hoping this will add more depth to our department so that we can all respond to anything that happens. Everyone will still have a primary focus, but it will just allow a little more depth. Since Jake's last day, I've been doing a lot of food pieces. We're opening up everybody who's seasonal, all of the temp events. I went today to the Special Events Advisory Committee, and we just discussed 4 or 5 events that were approved. Barbel's Parade, what is the one, the UU Church music event, and 4th of July, as well as the Farmers Market in Annisquam, that were all approved, and their vendors will be permitting through us. And most importantly, we have 6 new brand new food establishments that were being permitted and reviewed currently. Sugar Magnolias is requesting to have a semi-permanent food trailer at the campground, the Atlantic Campground. That may be coming before the board on Tuesday for some variance requests for a very unusual setup. The Burn, what was it called? Blackburn.
Used to be Howard Blackburn, before that Halibut Point, I believe.
Yeah, so that's gone through a full gut and will be reviewed for compliance. Jenks Food for Your Soul, which is a takeout fried chicken facility at the shared kitchen on 23 East Main Street, which is now the host of, I think, 6 vendors. So we'll be speaking with them. And then Napoli's, Angela's Food, and we opened a marijuana facility the other day. That's under our, Bria and I went out and checked out this very large and fancy marijuana facility, which also had edible cannabis retail, So we permit both the
Is that
marijuana side.
Essex Ave.
Yeah.
Yeah. So that was entertaining. Um,
You tried the brownies?
They're very strict, you know, they have a lot of regulatory requirements and we, even though it wasn't open yet, we had to go through a whole sign-in protocol. They take it very seriously. And I think we've mentioned a couple times in the past, we are updating a lot of our processes. We are now using C-Click Fix for basically all workflow. Anything that comes in that is asking something of staff goes through C-Click Fix, and we can monitor when it came in, how long it sat in queue, and when we responded. And same for general nuisance complaints. We're really working hard to increase our response time and then our enforcement on the back end and follow through. And then the last piece is the disposal system construction permit, which Catherine has been like super helpful with. It's a very lengthy process to get this one up in OpenGov or Viewpoint, as it's also called. It's just a more complex permitting process than the straight up way most of the other permits get issued. So we hope to have that up and running maybe by the next board meeting, as we hope. So that's all I have. Any questions?
Does that last one you mentioned have a physical location? Is it?
Disposal system construction permit. It's in Viewpoint. It's the one of our last things that we do. So we permit food through Viewpoint. It's a city permit tracking software.
It's software.
Yeah.
It's a facility.
Oh, I'm sorry. No, it's the software. And it will allow all the work that Leslie's doing, or not all the work, her permitting of the work she does to be in the same system as the rest of the city's permitting.
Great.
It's been another busy month. I think one thing I'll bring up is the special hearing that we're gonna be having next week on Tuesday regarding one of my housing complaints. It started out with one tenant with a cross metering issue with their electric. They had an almost $5,000 electric bill over the span of 2 months. They're paying for multiple, pretty much the entire building at this point. We definitely know that they're on the basement's utility. And we ended up doing a second inspection was requested for the people living in the basement unit, which is an illegal unit according to the building department. They have no heat, have been using space heaters all winter, which would then drive up the electric bill for the upstairs tenant. There's just a lot going on in this unit. The unit had the kitchen, it used to be a unit, the building department had everything removed years ago, was put back in. Between back in 2015 and now. So it is well known that it is not supposed to be a legal unit, but was still put back
This
to
is
that.
you're having a public hearing on this.
Yes, we will be having, exactly. we will be
And that's
having a
why
public
we were
hearing.
late.
And that's why we were late, we were there. The landlord was there, and we made sure that she understood that she couldn't just kick the tenant out in the basement unit, and she'll be there at the hearing.
Anything else to add about the volumes that you're seeing here? No?
Yeah, just the usual. A lot of complaints coming in, not a lot of time to get out. Especially a lot of general nuisance complaints, mainly around rats and trash. And I have a feeling we'll have another housing issue that might also need a hearing in the future that I have not been out to yet, but will be coming down the pipe.
Well, not perfect, but
Yeah.
so you've already had the food update via Gabby's discussion earlier. So if we could turn to Leslie now to do the Centerms review.
Thank you. Another busy month and getting busier with the spring season construction. I've taken out our two new recruits to show them what we do and maybe encourage them to come over to do the inspection, so that's been fun. Yeah, just a lot of the same. Anything spectacular that
I think it'd be interesting for you to talk about 20 Main Street.
Sure. Yes. Last week, we had a septic subcommittee meeting and 20 Main Street is looking to do a subdivision to two lots. And because it's only two lots, they won't need to do the subdivision water quality regulations piece that typically a subdivision needs to do, because usually there's more than two lots.
Two single family homes. Is what
Two
they're
single-family
proposing, which I don't
homes.
think is.
Right.
So where is
possible
that
in the
next
zoning
to?
area.
That's it's across from Virgilio's,
Yeah.
roughly. It used to be like a marine
Yeah, yeah.
supply place.
Yeah.
They have another plan as well. I think that they're submitting, which is for a sizable, building with multiple retail and residential. But they've also, I think, to protect their claim on zoning. I'm not really clear on exactly the strategy there, but they've also submitted this plan, which required a full review by a lot of people to be sure that, that we can offer effective comments in our case to the planning board, and the planning board has to take it up just as if they would another.
That's downtown, so.
Yeah, but what I was told is they can't do single family homes and stuff in that location from a zoning standpoint. They need a special permit to have two family homes in that area. So, the whole plan sort of would. I mean, we're not the zoning board, so I'm not gonna comment on it, but we got through that one. But it took a lot of work to get through that one, right? Because it was, whether it be real or not, we still had to proceed, and a lot of hours were spent trying to pick through how we would get the proper response.
Yeah.
Anything else, Leslie?
Maybe Weston and Sampson, 187.
Sure.
So, the water quality assessment report that the applicant for 187 Atlantic Street submitted is now under review. The applicant has paid the city, and the city will be paying Weston and Sampson to do a review based on our regulations. And we met with the consultant this week, and it was very interesting to talk to him. He seems very knowledgeable about nitrogen and watersheds in terms of the impact of septic systems, and then the impact that nitrogen will have on the water bodies.
So this is a quite a large proposal,
Yes.
correct? All septic.
Yes, there's seven, I believe it's 7 lots along the street on Atlantic Street, and they're each 2-family. So I think it might be 6 bedrooms per lot. And
Then there's multiple.
and then they're also talking about behind
Right.
exactly what they're going to
Is that
propose.
also part of the current proposal, or is that just
It's part of the
discussion
plan.
at this
It's
point?
on the plan.
Yeah, it's it's a very preliminary report that
Okay.
the consultant has made clear to us that his review of the report, it's very it's called preliminary, and it is, so he will be telling us, and we'll be telling the applicant all that needs to happen to make it a full analysis.
It's for the subdivision water, the subdivision water quality.
Yep.
Impact on that. But that took a while to source that resource, to have the technical assistance, and now we're contacted further, so it's terrific, and we can use that resource going forward as well for other applicants, which is nice. Thanks. Any other questions on? Joe, do you want me to keep driving here to get
Sure.
to, okay, thank you. So next we hear from the public health nurse, Cindy Junker.
This is agenda item number 10, page 14. I'm not gonna go over everything. As you can see, our respiratory illness still accounted for 73% of our state reported infectious diseases in April. That should go down very soon. Hepatitis A, we were able to hold a clinic, another clinic at the Gray Center, which I offered hepatitis A, Tdap, and COVID vaccines. So we gave out 5 Hep A, 3 Tdap, and 2 COVID vaccines. By the end of the month, Northeast region in Massachusetts was experiencing a low number of influenza cases, but as of the date of this report, it was still moderate. However, on Monday, when I looked at the report again, when I looked at the data available by Monday, both the Massachusetts and Gloucester data is down to low for influenza. So I'm happy about that. I'm hoping that it might be my last influenza report. And maybe we'll move on to tick-borne diseases next. And maybe foodborne diseases in the summer,
Oh, come
because
on.
those are always fun too.
Yeah, rehab their way.
Oh, yeah, they'll really be happy with that, won't they? I forgot about that. And I also gave out quite a bit of Narcan during the month. As of the submission date on this report, I had given out 38 kits, and between that date and the end of the month, we gave out 11 more. So we gave a total of 49 Narcan kits last month. My mother's, North Shore Mothers Visiting Partnership still going well, visiting a new mom on Tuesday. So it seems like I'm getting like 1 response a month. Usually it's about between 9 and 14 births, that maybe 8 or 9 to 14 births that we're seeing per month. Yeah, it's almost like 10% of the people will respond to me, but they've all been very positive, and I always look forward to doing those visits. I also ordered 10 more doses of Shingrix, which arrived today, so that we can still be in business with offering that to our the public, because that's been very expensive for people, and it's an important vaccine for them. And I think that's about it. Does anyone have any other questions?
Does anyone hear about whether ticks are?
So last week, we still are the lowest. I was looking at the state data, and the Essex County is still as lowest as far as tick-borne ED visits, et cetera. But there was a Powassan virus case that was found in Sharon, Massachusetts, usually very rare. Yeah, that was last week. And it was after this, after I submitted my data, I found all this stuff. It is very rare. Sometimes it can be very serious. So we'll keep an eye on that. It is the same tick that causes Lyme disease, so the black plague tick.
Nasty little bugger.
Yeah.
All right, thank you, Cindy. Unless there's any other questions from the board? No? Last up is Chelsea, who's joining us remotely. Chelsea was at a training. She and her team has been very busy. So Chelsea, can you take it away? And she's on page, you're looking at page 23 for Chelsea's content.
All right. Hi, everyone. Can you hear me okay?
Yes.
Yep. Okay. Yes, as Dominique said, we've been, as has everybody in this department, been super busy this past month. A couple things that I'll highlight in the report. And then again, if people want me to go into detail about anything in particular, just let me know. We've been continuing with implementing team mental health first aid at the Gloucester High School with all 10th grade students. We had our third of 6 in-person sessions this past yesterday, which went well. We also had yesterday in the evening, actually all day, we had a speaker pair, Kathy and Chris Sullivan, come into the school to speak in the morning with all 11th grade students, in the afternoon with 7th and 8th grade students at the middle school, and then in the evening to the community, to parents and community members, all about their own personal experiences with substance use and addiction, really in a preventative manner on how to keep kids safe. They're really powerful, very powerful presentations, and I definitely think the folks that were in the room were really impacted. We also had a resource fair leading up to the evening presentation so that community members could learn about the resources that are available to them in Gloucester and Cape Ann. That was the third of a 3-part speaker series that we've had in partnership with the Gloucester Public Schools. So it's gone really well, and we're hoping to do it again next school year.
If I could interrupt, do you have an idea of what the attendance was at the evening presentation for the Sullivans?
I didn't have an exact count. I'd say it was around 50. I tried to count people. We always wish it were
Mostly
higher.
adult?
I'm sorry, say that again?
Mostly adults?
It was actually a mix of adults and students. I know that the athletic director highly encouraged his student athletes to attend with their parents or guardians. So there definitely were some students in the auditorium that were there with their parents. And then there were also, we had some of our Gloucester Youth Leadership Council students there helping to volunteer. So they were there. So I would actually say it was kind of a mix. And it's appropriate for both teenagers and for adults. We recommended 14 and older for the age. And Dan did a ton of the work to organize that. So shout out to Dan. You really did all of the coordination of Kathy and Chris throughout the entire day. So
I had lots of help. I think there were about 50 or 60 people there, maybe 10 to 15 students. The 3 health ambassadors from the high school introduced them at all 3 events, so that was really nice for other students during the day to see these high school students who are in the mental health ambassador program. So which reinforces the message from the Sullivans and other speakers, as well as the teen mental health first aid program that we're doing with the 10th graders. So
Thanks, Dan.
So I don't know whether the board is aware that the male speaker, at least, is an ex-Patriot football player. And so his story of coming in conflict with alcohol to start with, and then worse things, and getting through it, is a message that particularly athletes can relate to. I mean, it makes an impression. So kudos to you guys for making that happen.
there was one 7th or 8th grade boy who came up and was talking to Chris and was just like, he was, I can't believe I'm meeting a Patriot. Would you sign my shoe if I take it off? So I took out a business card and got the signature for him on that, but it was fun.
Yeah, that's good.
Oh, he also passed around his Super Bowl ring to about 400 7th and 8th graders. And I was pretty shocked. I guess he's done it a few times and he always gets it back. But I was pretty surprised when that happened.
That's great. Thanks, Dan. Anything else, Chelsea?
Just really briefly, a couple events that have happened and are coming up. So last Saturday, we had Drug Take Back Day in partnership with the Gloucester Police Department and the Rose Baker Senior Center. We were able to hand out Narcan at that event, as well as obviously collect residents' unused medication that was brought to Danvers to be safely disposed of. So that was really great. And that happens every April and every October, so twice a year. We have a program coming up, or an event coming up this coming Saturday, with our Gloucester Youth Leadership Council and our North Shore Youth Leaders. It's our Sticker Shock campaign. So it's a campaign that's very much in line with the message that Kathy Sullivan gives during her talk around not providing alcohol to minors. So our North Shore Youth Leaders will be going around with David and I and with Officer Scola, the high school resource officer, to some liquor stores in the center of town who have agreed to participate in this, where we'll be putting stickers and signs on windows, reinforcing the message around the social host law and that it's illegal to provide alcohol to minors, and really trying to also include a positive message around, like, we as a community really care about our young people and we want to do whatever we can to keep them safe. That includes not providing alcohol. So this is particularly important, again, as a follow-up to Kathy Sullivan's presentation, and then also as prom season and graduation season approach. So that's happening this Saturday. And lastly, our North Shore Youth Leaders, again, are also very busy planning their end of school year event, which will happen on Saturday, June 8th, from 12 to 4 p.m. at the Rockport Teen Center. It's a free event for teens. We're hoping to get folks from all over the North Shore. It's going to be super fun. I will have a flyer to blast out to everyone. We're really trying to spread the word as much as possible. It's a youth-led, youth-run event with adult support, and it's really focused on the importance of allowing yourself to be a kid, to de-stress, to get access to some mental health resources, particularly as folks or as students head into the summer where they're not connected to school and they're less connected to resources than they normally are during the school year. So it's like a last opportunity to have some fun and to learn about resources available in the community. And that's it.
Thank you.
Thanks, Chelsea.
Is that it, Dominique, for the reporting from the department?
It is, I
Yes,
just want to remind everybody on Tuesday night at 6:30, we're going to have the hearing for the address again, Bree,
10 Commonwealth Ave.
and Commonwealth, and I know not all board members will be there, but we do have a quorum, and thank you for those that can make it. It's important, and we're glad you can be there.
It's gonna be at Pond Road.
It's gonna be a Pond Road, yes, in our building, which is going through some construction, but there's no other available rooms in the city, so we're really scrambling. It holds, I think it'll hold all of us, it holds 8, you're tight, but it holds 8 people.
Is it a hybrid meeting or is it just?
It will be a
in-person?
hybrid meeting,
Okay.
yep. Yep, and so if you want to attend remotely, that's completely fine as well. That's the most important thing, sure everybody knows.
Good. Last item on the agenda, concerns of the board. Any comments from anyone? No? So entertain a motion to adjourn.
So moved.
Second?
Second.
So I presume we're adjourned. Any objection to being adjourned? No?
Bye, Chelsea.
Good meeting.
Let Chelsea.
Thank you.
Thank you, Chelsea.
Yeah, but he's. Yeah. And also.